quite rapidly. And as people always do, they sought stability, that natural balance that humankind craves. I think that experiences over the last several years have led us all to a place of mutual understanding, an agreement that the world does indeed still need strong leaders. Now, perhaps leaders with different skill sets than in the past, but in this complex time we live in, our organization and our communities need leaders with the experience and skills to create structures that can flex to withstand the chaos of the world, and those who demonstrate the emotional intelligence to remain steady at the helm in spite of all of the challenges. So today, I was asked to speak about my experiences leading two of the top U.S. hospitals, because I was at Duke for 32 years prior to going to Hopkins, through some of the most difficult times in modern history. And I'm going to share with you how I managed to move forward through all difficulties by staying focused on organizational mission, vision, and values, and by always recentering myself to stay focused on my purpose in life. And it is my hope that by sharing stories from my journey in leadership, that you will take away actionable strategies to support you and your own leadership path. Now, to provide context for my story, I want to begin by telling you a little bit about myself and my journey through the last 40 years in healthcare. You see, I grew up in the Midwest region of the United States. It's a state you might have heard of. It's called Ohio. Now, if you've never been to Ohio, you need to know that the economy is primarily driven by manufacturing and farming. My parents owned a pig farm in a rural community, and that's where they raised me, their oldest child, along with my brother and sister. Now you understand why 6 in the city is even more important. When I first went to school, I went to Capital University in Ohio with the goal of studying music, voice, and piano. And Jack, no, next year I will not be on stage with the CEOs. Because my parents were poor and could not afford my tuition, in the summers I worked at 2 different nursing homes in town. In the morning I would provide music therapy for the residents, and in the afternoon I would bathe the elderly patients, feed them, and put them to bed. And it was during that time in my life that I discovered my calling for caring for people. And I decided to change my major from music to nursing. And that was a life-changing decision that ultimately led me on a path to be here with you today. After college, I began my career as a nurse at Duke University Hospital. I started at the bedside and trained to become an oncology clinical nurse specialist. During one of the last major nursing crises in the U.S., I was asked to take on a leadership role as a nurse manager for a new unit. And that's how I began my career in healthcare leadership. Through the years, I rose through the ranks, eventually becoming Duke University Hospital's Chief Operating Officer, before becoming the President of Duke Hospital in 2009. And then in 2018, I began my current role at the Johns Hopkins Medicine as President of the Health System and Executive Vice President of Johns Hopkins School of Medicine. So it was during my very first role as a nurse leader at Duke University Hospital that I actually received my very first lesson in leadership. You see, at the time I was a new grad. I was only 6 months out of nursing school when I became the charge nurse on evenings and nights. Now, for those of you who are in management in the audience and non-clinical, it's not something I recommend. But at that point in time, the leadership had to. It was during the great nursing shortage across the U.S., and they didn't have enough experienced nurses to take the charge nurse role. Now, for the clinicians in the room, I'm sure you'll appreciate, but it was one of those evenings that if anything could go bad, It happened. On team 1, I had a code blue that was called, and halfway through that code, the team on team 2 called another code. And as the charge nurse with only 6 months of experience, I was running back and forth from one side to the other. And as the evening started to calm down, there was a patient's husband who had been in the hall watching me run back and forth throughout the unit. His name was Dean Bolton, and he was the Dean of Students at the University of North Carolina at Chapel Hill. That night before I left, he stopped me and he said, "Kevin, I need to teach you a valuable lesson in leadership. Crazy people will make you feel crazy only if you let them." He said, once you become a part of the chaos, you become a part of the problem. He said, leaders rise above the chaos so that they can separate the facts from the emotions and lead people to the other side. You know, his words still ring true for me today. You know, perhaps I've become more reflective through the years, but the way I see it now is that each lesson I've learned over the last 40 years has helped me better appreciate the art that is leadership. It's like weaving a tapestry, and each new thread you introduce becomes a part of the fabric of your leadership journey, and also your life. When you're just starting out, you question your ability to navigate the simplest issues, and then you learn, and you grow, and eventually, with experience, you realize that you are the textile artist. You can't predict every issue that will come your way, but what you can do is learn to become a better artist. You need to practice your craft, build your skill sets, build your network, and appreciate the importance of relationships. And remember that as an artist, innovation will set you apart from all others. And that's where my second lesson for managing an extended crisis. Be innovative. Begin to think about how you can think outside the norm. That was the approach I took during the global financial crisis that began in the United States in 2008. It was during that crisis that I was promoted from Clinical Chief Operating Officer to President of Duke University Hospital in June of 2009. At that point in time, there was a lot of uncertainty in the world, if you remember back, and while it had been comforting to rely on the traditional methods of doing things, I knew that in that environment, sticking to the status quo would not work. At that time, Duke Hospital was over a 1,000-bed teaching hospital with about 10,000 physicians, staff. It was also one of the biggest employers in the state of North Carolina. So the decisions we made would not only impact the hospital and the health system's future, but our choices would also impact families and businesses in the region. In the turmoil of that time, many local businesses shut down, hospitals closed, health systems folded. And almost all of our competitors cut jobs or furloughed their employees. But we made a very different choice. Instead of laying off large numbers of FTEs, we renewed our commitment to our people. We managed the fallout from the recession by creating organizational-wide campaigns to manage unnecessary spending. You see, we did the big things and the small things because both matter. Managers trimmed their budgets, and then we benchmarked them, and we looked at how to be more efficient, and we trimmed them again. Our supply chain leaders ran a report to identify which office supplies were ordered most often. Then they did the work of standardizing the choices available to limit variation in cost and ensure we were getting the maximum quality products for the money we were spending. We also asked managers to go through their offices and find supplies and furniture, and I know you have no extra anywhere in your organization, but I can tell you if you look really hard, you'll find it. And we brought it all to a central location and opened the doors for leaders across the organization to shop for free. In this way, we became better stewards of even our smallest resources. We've also brought teams of clinicians together to review which materials they used most often and make selections to standardize clinical supplies and devices that was used throughout our organization. Again, we were then able to negotiate pricing to maximize quality and limit the cost of materials. We also initiated a capital management process in which our leadership reviewed all requests. We called this our less than $1 million, greater than $1 million process. We held weekly discussions with the senior leaders, and we painstakingly went through each list, choosing what we would fund within the current budget and what we could safely hold off on. During those weekly meetings, we also focused on position requests. We had a dedicated position executive that was over performance management, and each week senior leaders got an overview of the current position openings and requests, and this way we were able to discuss which positions they had to keep in their shops and which ones they could give up. It's also important to note that we manage positions through attrition, and by initiating a separate position review committee to manage any new requests. We approached this process holistically, with all leaders agreeing to prioritize clinical staffing when making decisions. As a result, unlike our peers, we never did large-scale layoffs. And even when we had to do a small round of layoffs, we were able to find position in other areas of the organizations for qualified people who were losing their jobs. As a result, our people felt connected to a greater purpose, greater than any one of us. And so years later, when faced with undertaking 3 major initiatives in a short period of time, there was a strong sense of teamwork that resonated in the organization, a feeling of being able to navigate challenges together. Which takes me to my third lesson in leadership. One that I learned after I asked to open a new bed tower, implement a new electronic health record, and open up a cutting-edge cancer center, all in the span of less than 5 years. And that lesson was the value of creating strong organizational structures while encouraging teamwork. Because creating a strong organizational fabric requires you to mindfully create structure and processes along with ties that bind you together as a team. By that time, my career had evolved, and my role wasn't just about doing the important work of managing people to ensure that everyday work was done. But as president, my role was to lead people to create the healthcare organization of the future. And I would challenge you today to think, is that your role? Through the strategic planning process, we had known that we wouldn't have been able to meet the needs of the community based on the predictive models of anticipated future capacity needs. And after analyzing data related to then, current, and anticipated community needs, the decision was made to build a new state-of-the-art patient-focused cancer center and a new bed tower that included increased intensive care capacity. At the same time, hospitals across the world were being challenged to implement new electronic records, something we now know as EPIC. I knew that would get a chuckle. By then, I had become accustomed to managing the complexities inherent in leading within a matrix organization, which has its own set of issues. By its nature, academic medicine, with its three missions focused on patient care, research, and education, is complex. And I had already learned the importance of creating structures to ensure we could achieve all three missions. But I also knew that taking on three major projects in such a short period of time on the tail end of a large-scale financial crisis would be challenging, to say the least. Again, this was around 2012, and the United States had just come through the Great Recession. But because we hadn't sacrificed jobs during the financial crisis, our team was strong, and I wanted to build off of the sense of that connectedness. So I asked our marketing team to bring an outside firm to really help us develop a new set of mission, vision, and values that would resonate with our team and support the work that we had to undertake over the next 5 years. Around this time, I also began to socialize our leaders with the Baldrige Framework. The Baldrige Framework was developed by the U.S. Commerce Department's National Institute Standards and Technology. The Baldrige Excellence Framework is a set of guidelines that provide a system approach for evaluating and improving organizational performance. Key to the program is the opportunity to learn from organizations that have actually won the Malcolm Baldrige Award for Excellence in Quality. And so I sent leaders to other organizations to bring back best practices that could help us along our journey to excellence. And I also brought in experts to help assess where we were on our journey and to help us map out where we needed to go in order to achieve what we needed to achieve over the next 5 years. Again, at that time, Duke was about 10,000 physicians and staff working across several different regions. And taking the time to champion a team mindset, assess current performance, and develop a culture. And I need you to stop there for just a minute. Culture either makes it or breaks it. But develop a culture of continuous improvement based upon standard processes and best practices allowed us to build the foundation we needed to be successful over the next decade. Key to our success was leadership process development and implementation based upon the Baldrige Framework. This centered on mindfully building an annual leadership work cycle to manage the workflow at the senior level. We built all of our hospital's work into that leadership process. There were biannual meetings, which allowed leaders to identify the work that needed to occur over the next 6 to 12 months. We would agree on targets, we would link those targets to the health system level, and then we would cascade those targets all the way down to the individual level. Now, to keep the staff motivated, we had annual all-staff events. Alongside my other senior leaders, we reviewed the prior year's performance, we introduced goals for the new year, and inspired all of our physicians, staff, with stories of the Duke experience using a model developed by the Baldrige Award winner Sharp Healthcare. The goal was to ensure that all team members not only understand organizational goals, but felt connected at a deep level to the mission, taking them back to their purpose of being there, and also making a connection to each other. And while the event always had a sub-theme, the overarching theme was, as the minister spoke to today, it takes a team. A phrase that became an important one used throughout the organization to magnify the importance of everyone's role in achieving excellence. We also drove the development of becoming a more data-driven organization. We poured resources and support into the development of an Office of Performance Improvement. We embedded performance improvement conversations into manager meetings, daily huddles with frontline staff, initiated the development of a simplified dashboard that made viewing key organizational indicators easy. had linked electronic storyboards installed into individual unit break rooms to show local performance in the context of our overall organizational goals. And we developed innovative ways to share our performance improvement stories across the organization. We also invested in the training of our leaders and sent several to undergo Baldrige Examiner training in Six Sigma, reliability, and we embedded those leaders into the PI teams, the performance improvement teams, to help lead that work. Our result over time demonstrated how marrying formalized processes, structures, accountability, and focus can result in organizational-wide success. Our teams thrived because everyone understood their roles as individuals in achieving our mission, and we all were committed to furthering the Duke tradition of excellence for future generations. While many organizations were still managing the fallout from the recession, our team actually grew stronger together, celebrating the successful opening of the new Cancer Center and the Bed Tower, and achieving national recognition for the organization's smooth implementation of the electronic health record. Then, in 2015, Duke Hospital achieved record-breaking financial success. For this work, years later, I was awarded Columbia Business School's Deming Cup Award for Operational Excellence and Continuous Organizational Improvement. And that is a recognition that I'm extremely proud of, because I believe that organizations built on strong foundations are the ones that will help our world move forward no matter what comes. And that award also reminds me of the team that was behind our success. You see, we can't undervalue the importance of the people in the process. When you create strong infrastructures and make people feel that they belong to a team, when the tough times come, they're actually much easier to bear. And when people know you have their best interest in mind, it's a lot easier to build on that trust during the times of crisis. You see, I believe you can't expect to become a great leader during a crisis. First of all, you need to become a good leader. And then when the crisis comes, you have to become a great leader. Because it's in those times when the whole world is shaking, people will trust you to lead them through a crisis and to the other side. As Dean Bolton said, great leaders rise above the chaos, separate the emotions from the facts, so that they can lead people to the other side. You know, looking back over the last 40 years of my career, I can see how each crisis and each challenge that I managed prepared me to deal with the next one. You know, I learned to not get caught up in the chaos, and that allowed me to be a better leader and assume higher positions over time with increasing levels of responsibility. The financial crisis taught me to be innovative in my approach to managing a crisis and to take care of people along the way. And managing multiple large-scale projects in tandem after the Great Recession taught me to apply everything I had learned to that point, and then add structure and process and champion teamwork. Then, in 2018, I became the president of Johns Hopkins Health System and executive vice president of Johns Hopkins Medicine. You know, when I first got to Hopkins, I thought my role would be to lead the organization and working more as a system with a focus on us all working as one Johns Hopkins Medicine. What I didn't know was I would be responsible for leading our health systems and Johns Hopkins Medicine's unified response to a global pandemic. And so the lesson here became how to quickly evolve into responding to a pandemic. And as we went through the pandemic together, The lesson was how to take care of each other when undergoing stressful change. So there are times that we have to reimagine our purpose and redefine who we need to become in order to lead our team. And especially in this moment, my responsibility was to lead the team through a global health crisis. Early on during the COVID crisis, I started having concerns about our staff's stress level and anxiety and the impact that the pandemic was having on their personal and professional lives. I saw it being challenging to even our most seasoned team members as businesses and schools closed. Parents and caregivers were having to figure out how to navigate homeschooling and childcare and parent care. Some had partners and spouses who lost their jobs when businesses shut down. And if you remember, during the early stages of the pandemic, there was this heightened sense of fear. People were afraid of the possibility of taking COVID home and making their loved ones sick. And I also remember very little was known in the early phases about the transmission modes at the time. And I also personally witnessed the moral distress of our providers caring for patients who were dying from COVID without their loved ones being at the bedside. And it reminded me of the same type of emotions we experienced as providers in the 80s at the start of the AIDS epidemic. So I knew that we needed to support our team, and so this became a standing topic discussion at our regular leadership roundtables. We tapped our internal experts and developed interventions to help our employees navigate the many challenges they were facing. Our Office of Wellbeing that we created developed a one-stop website where staff could find help from everything from sleeplessness to depression to support for child and elder care. We held virtual town meetings where we partnered with our infectious disease experts to share what we knew at the time about COVID and how staff could protect themselves and their loved ones from getting sick. We also started a fund based on a gift from a grateful donor. It allowed us to provide financial support to ensure our most vulnerable employees had food for their families, had laptops so their children could learn from home. It also covered hardships like rent and household bills. We also partnered to create food pantries at each of our entities for our vulnerable employees. And one of our leaders actually went after a grant so that we could actually provide food to vulnerable families in our communities. And then, as the issues of social justice came to the forefront of our nation and of our world, we had to develop additional resources to support our physicians and staff of color. We provided manager training to support facilitation of effective discussions about social justice. We also held town hall meetings in which we had very candid conversations in concert with our staff. It was hard, but we spoke openly about how we could create real and lasting change together. And I must say to you, this is a part of the work that will continue for a very long time. We also introduced a new program called Honoring Our Pandemic Experiences, better known as HOPE. This program honored our team members' lived experiences by engaging them in a series of Hopkins-sponsored events. Our goal was to provide avenues for all of us to process and honor our individual and collective pandemic experiences using the arts, music, creativity, and reflection. And the lesson here is, how do you as a leader demonstrate your personal understanding of the issues? How do you as a leader demonstrate your personal understanding of the issues? Well, what I did during COVID is I put my white lab coat on and I supported our clinical teams by working alongside them in our hospitals. Each of us were experiencing staffing challenges. I took shifts in our emergency room, and yes, I can still put an IV in, I can still put an NG tube down. I did my competency check off before I went out into the clinical setting. But it was important for them to know that I wanted to understand enough that I went and worked beside them. The next lesson that I learned was that it takes partnerships for us to be successful in a crisis like that. I also collaborated with others through what we called a public-private partnership that I led with Dr. Mohan Santa, who is president of the University of Maryland Medical System. And we also partnered with the city leadership and the state leadership in Maryland. Because I realized this was such a big crisis, it was not something that we were going to be able to pull off by ourselves in serving our community. Because to successfully address the needs of our community during the pandemic, we realized that we had to reimagine how we would work together across our organizations. Part of the vision included the creation of the Baltimore area COVID-19 public-private task force co-developed by Johns Hopkins and the University of Maryland Medical System. That task force facilitated communication between the two academic health systems. Our policies were the same. We wrote the policies for the state and the city. We educated private businesses. We also worked with the city and the state to develop data-driven decision-making across the board. And as a member of the task force leadership team, Mohan and I worked together with other leaders to strategize and use our combined resources in a unified response to the pandemic, which was a crisis. You see, this is very different from the past, and the minister mentioned this. How do you manage during a crisis? Because in the past, the University of Maryland Medical System is one of our regional competitors. But in the midst of a crisis, we needed to serve our community, and there was no better way to do it than to do it together. With members who represented all of our organizations, this public-private task force focused on data sharing, a statewide call center, interconnectivity, communications, and developing strategies to test, care for, and vaccinate special populations. These special populations included people experiencing homelessness, people who live in long-term care facilities, those who were incarcerated in jails, prisons, and detention centers, and the vulnerable population of those living in nursing homes. Our call centers allowed us to manage the flow of COVID patients throughout the region so not to inundate any one facility. We also partnered with the University of Maryland to convert the Baltimore Convention Center into a field hospital. We co-managed a 250-bed COVID facility that was built specifically to manage the volume of patients that surpassed our capacity in our hospitals. We also used that facility as a statewide testing site, a site for mass vaccination, and to house an infusion center that administered FDA-authorized monoclonal antibody therapies. Our ability to share data and resources were all a key part of that endeavor. Early on during the pandemic, based upon the data that showed there were a large number of residents in a certain zip code that tested positive for COVID-19, the task force opened a drive-through testing site at a facility in that area, and based upon additional data that showed the COVID-19 in certain zip codes were disproportionately affecting members of the African American and Latinx community, the team developed and distributed flyers about COVID-19 in targeted communities, and Johns Hopkins Medicine provided funding to support educational events in those communities. So we went from being competitors to working side by side. You see, we reimagined our relationships in support of a higher purpose. And our future success will require us to continue to rethink these key relationships to support the health and well-being of the people we all serve. If you ask any healthcare leader in the U.S., what the effect of the COVID-19 pandemic on this country has been, we will tell you that it actually sped up the rate of change in our industry faster than any one of us could have predicted. In an extraordinary short period of time, we went from identifying a new virus that had the capacity to end an astronomical number of lives to creating, approving, and distributing vaccines that have potentially saved many generations. We've created new infrastructures and training to support telehealth. We've also introduced new opportunities to deliver educational models remotely to train the next generation of learners. And at the same time, we've created new modes of data sharing to drive database decision making. And we're doing a better job of breaking down barriers so that researchers can access that data to create solutions faster to support the greater good. In short, it's something we all have to do. We have to reimagine what patient care in the future is going to look like, research and education. And every time I have the opportunity to talk, I say this: things will never go back to the way they were before COVID. So get over it. Let me say that one more time. Things will never go back to the way they were before COVID. So get over it and reimagine. And that brings me to a question. And if you attend my session tomorrow, I'll expand on this more. But my question is, who will you need to become in order to manage the organization of the future? Who will you need to become to manage the organization of the future? What new skill sets will you need? What resources? What relationships do you need to build? Because remember, I started studying music, discovered my passion for healthcare, and now I stand before you as the president of an incredibly extraordinary organization with the collective ability to impact generations of people all over the world. And becoming who I am today has required constant upgrades to my own system of being. With every evolution of my career, I've had to become a newer, better version of myself. And in order to manage all of the crises I've seen over the last 40 years in healthcare, I've had to transform 1,000 times. Because today's global environment requires us to be dynamic leaders who are brave enough to transform time and time again. And the final lesson I'll share with you today stems from a conversation I had with a colleague recently. One of my colleagues recently asked me, Kevin, how do leaders get through the really tough moments? How do leaders get through the really tough moments? And here's what I said. We get through it by mindfully noticing the hope, grace, and faith that still exists in those moments. You see, even in those moments, there is hope all around you, but only if you look for it. There is grace all around you, but only if you look for it. And there is faith all around you, but only if you look for it. As you leave here today, may you be reminded of the hope we bring to the people we serve in our communities. May you be reminded of the grace that has brought us all together in this moment. And may you be reminded of the important role that faith plays in our journey as leaders. Look around this room. There are powerful connections to be made all around us, but only if we look. Thank you for allowing me to be with you today.
Thank you.